knows education, it's a slow-moving thing. We don't like change in education. That's why our education system is still set up when it had assembly line setups in America. We still come to school, we sit the kids in rows, we move very slow in terms of change to help our young people be prepared. And with that being said, we're looking to replicate that, and with the help of the work that they're doing here at Rutgers, we can hopefully start to have more and more of our counties educate our school districts to understand that trauma is a big part of our kids' lives today. Either what they see at home, the streets, or our media. They're exposed to it, and it's something that is not going to go away. So we need to best equip our teachers and other educators within our schools in order to deal with it. I thank you, and I'll be here if you want to ask me any questions.
Just as a little courtesy, I often file a lot of complaints with the New Jersey Department of Education. I see some of my colleagues out there too also do the same. And we understand why you wouldn't give it to the SRO. That's Student Resource Officer, for those who don't know, okay? Our next speaker is, I'm pleased to say, is Dr. Kelly Moore. She is a clinical psychologist, licensed in New Jersey and Pennsylvania, and director of the Rutgers Children's Center for Resilience and Trauma Recovery, where she works to provide trainings to mental health providers and advanced students in evidence-informed assessment and treatment of complex trauma in children ages 0 to 10, along with their caregivers. She also provides expert consultation and support to providers seeking to gain expertise in treating this vulnerable population in New Jersey. She also has expertise in the treatment of trauma and anxiety disorders in children and adolescents, and specializes in the treatment of PTSD and OCD, that's post-traumatic stress disorder, and obsessive compulsive disorder. I'm going to use you as a reference from now on. I have a couple of cases too for you. She also has worked with community mental health organizations to integrate evidence-based treatment for families impacted by trauma in Philadelphia and New Jersey. She also coordinated with the New Jersey Department of Children and Families in 2014 and 15, conduct an organizational trauma readiness assessment in order to identify areas of strength and need in current practice and policies in the state child welfare division. She is a graduate of the University she received her doctorate from Rutgers University, and a part-time practice in South Jersey. I give you Dr. Moore.
Morning, almost afternoon. So I'm really honored to be here this morning and today with all of you. I was really surprised to get the invitation. I just see this as something that I do as part of my passion, so it's nice to be able to share that with other people. And I really feel at home. I'm from Willingboro, New Jersey. I heard mention of Willingboro, and I still live in New Jersey. I live in South Jersey, and I have 3 boys in the New Jersey school, 2 in the school district, and a little guy who's 5 months old. So all of the things we're talking about really matter to me personally and professionally. So I want to talk a little bit about a project. I'm hearing a lot about what's going on in the school, so this is really appropriate for me to stand here right now and talk about some work that I'm doing with colleagues at Rutgers and also throughout the city of Newark, and with the Brick schools in Newark. I don't know who's familiar with the schools at Brick. So we've been working on a collaborative project through some funds we received from Robert Wood Johnson. So I want to talk to you about that today and share with you some progress we've made on this work we've been doing since last April. So these are the partners. Greater Newark Healthcare Coalition is an organization that's comprised of leaders from numerous healthcare organizations throughout the Newark area. And then I'm a part of Rutgers University Behavioral Healthcare, along with some colleagues of mine. Some are here today. And the Brick schools, Avon and Peshine, have also been involved in the work that we're doing together. So I want to make sure I talk about The collaboration has been, I think, the most important part of our work around creating a trauma-informed school system with these two schools. So our work really was about how do we integrate trauma-informed practice into what happens in the school, because teachers and support staff in school have our children for most of the day. They're the ones that have them for a lot of those developmental milestones, and they're responsible for them throughout the day. So we really wanted to develop a program where we could give more than just a one and done training. We really wanted staff members to feel equipped to recognize trauma responses, but also to have some supports and resources in-house in the school that could be utilized so that we're not constantly kicking kids out of the classroom for manageable behaviors and or giving kids labels that they can't seem to come out from under for the duration of their schooling. And we really wanted to target our younger kids as well, because as we've heard, a lot of early exposure to trauma and toxic stress has implications for a child's ability to concentrate, attend, learn, all of those things. And these are not things that teachers necessarily learn in their training, just as there's things as mental health professionals that we don't learn. So in terms of our process of integration, I want to share with you a little bit about what UBHC does in general around school community programming. We have a number of school-based programs throughout the state, but our goal is really to recognize this understanding that academic success is not just about how much you can learn from the books. It's really about your ability to be sitting in the classroom and doing all the required duties it takes to sit and learn all day long. And so that has a lot to do with your emotional and physical and mental well-being. So our programs are aimed at tying these pieces together so that our children can be successful. And so we really like the idea of using a collaborative model, and our approach is really I'm going to borrow from one of my mentors at Rutgers as a student. It was Nancy Boyd Franklin, who is like my idol. She's my idol. So I'm thinking of her today because she always would talk to us about what it means to join when you go into a new organization and you're not a part of that discipline. And so I enjoy that process of going into a space I'm not familiar with, and how do you learn about the culture of that environment. So part of our training process was spending a number of months just deciding how to talk to educational staff about this in a way that makes sense, but also doesn't feel like an add-on, but just this is something you're probably already doing. We just want you to change the way you look at the kids. So we started talking about that lens of trauma-informed care, and I think as I go forward, I'll share with you more about how that ended up working out, and I think teachers really grabbed onto that concept. So our program has these 4 pieces. I'm primarily going to talk about what part I played, which was the professional development role, and a little bit about the next step, which is our screening and referral process that we created out of this. So what do staff need to learn? What's the most important thing for them to learn about was our professional development piece, but we also wanted to be able to provide them with services. I think the challenge is that when something happens in the classroom and teachers have a sense of something that's going on, they don't always know what to do or where to refer. And so we wanted to have some services in the school environment that they could have access to. So one of the benefits of partnering with the groups that we worked with is that we were able to have funds available to put some things in the school so that they don't have to go out of the school or rely on the parents having to call this place or that place to get the child some basic additional services if needed. So as much as we could do in-house, that was really part of our goal, what we could try to do in-house. So we also wanted to evaluate what we're doing. Was it working or wasn't it working? So I'm going to share a little bit with you about some of the goals of the professional development. So this was a series. It wasn't just come to a training for a day and then go back to, like sort of take a break from, everything and come into a training. So it was very hands-on. We actually engaged in a little bit of play during our trainings and really trying to do hands-on learning. But this was our target population, which was the BRIC staff. Every staff member came to our trainings. We did one day where we did the same training for 2 hours and everybody cycled through. Then we had another day where we broke it up into 2 large groups. Every teacher, every support staff person, the social emotional learning team, as well as the child study team were supposed to attend this. And actually they were required, so they all had to come. So since I knew they had to come, I had to make it fun because then you don't want people in there that are just, upset that they were forced to be there. So these are the 5 points, and I'm going to go through them a little bit more in detail with the time I have. But I think this slide pretty much captures what the content was and what we did for all of the subsequent trainings that we had, as well as some of the interventions that we created in the school. So we wanted them to understand, just by definition, what is trauma, what is toxic stress, what do we mean by that, what are the differences when we're talking about a discrete trauma versus a series of experiences that people don't really refer to as trauma. It's this is my life. This is what my life is like, so I don't understand what you mean. So we wanted to come up with some clear definitions about that, which we were able to do. And then we wanted to get the teachers to be very good at spotting when a behavior may be something different. And we used this concept of the trauma-informed lens. And I work with kids, so I love to have toys and things like that. So we actually had these sunglasses that we gave out at the first training, and everyone had to take one when they left because it was this reminder of the lens. When you put it on your desk, when you're looking at kids, I wanted them to just look at those sunglasses, and when little Johnny is acting a certain way, what lens are you using? Try to remember, take a moment and try to think about what's the intention behind that behavior. So we wanted them to get very good at that because our screening and referral program that we were creating, we wanted them to have the skills in place that they knew what to do. We've also spent a great amount of time talking about our own biases. So this is important because when kids come to school, they have a backpack and they bring a lot of things into the school besides just their books. We bring a backpack to school too, and we bring our stuff into the school, into the dynamic. And so we did different exercises talking about who's your favorite kid in your class? Who's your least favorite kid? Who's the kid you don't really get too upset if they're sick from school? We ask them these questions because we want them to start kind of owning their own biases, owning their own stuff that they bring into the classroom. Because I think you're not talking about trauma-informed systems if you're not talking about the people that work in the system. And another piece of that is the level of stress and burnout that occurs with people that tend to work in environments where there's a lot of stress. And so we used an instrument called the Professional Quality of Life Scale. It's a great scale that I heard about when I was working with DCF. And it really looks at not just how satisfied you are with your job, but also what is your risk for stress and burnout. And it's a really easy tool to use. We gave it at 2 different points so far, and we're still looking at the data from that. But it's a way for us to really let teachers think about how much stress they have from their job and really just take a self-inventory. And then really, I think essentially our strategies that we wanted to put in place were about how to create what I call a corrective experience. I borrowed that term from a former mentor in Philadelphia, about how when children are in spaces where there's constantly a lack of predictability, there's chaos, there's lack of safety and distress. Every one of us that work with children, even if it's just for a few moments, has an opportunity to provide a corrective experience. So we can be a safe place, we can be predictable, we can let them know what to expect. We can be aware of surprises and try to get out in front of behaviors if we're willing to take a step back and use that lens. So that's a big part of the takeaway, that we were trying to give to these educators. And the last thing, which is really important in our program, is the sustainability. Because once our time is done with this grant, this cannot end. It needs to keep going. So a big part of our work is around how does the school and the administration sustain this kind of work going forward in terms of hiring practices, training for new teachers, all of those things. So that's another arm of this that we're continuing to work on and talk about. So this is just I have a couple sample slides in here. 2 of them are hard to see, but this is the breaking down of the fight or flight that we were talking about earlier. I don't know that educators connect that to that chronic stress response. I don't know if they're connecting that to the experience of the kids that they work with, because a lot of times your fight or flight usually shuts down because you get to safety. And so when safety is pretty inconsistent or not reliable, that fight or flight response constantly being triggered, you do have kids in the school that you want them to concentrate, you want them to sit down and learn, but there's other competing priorities, like am I going to have a place to stay, am I safe, all of the things that have been discussed on our panel and the previous one. So again, Dr. Eskelin talking about, it's not what's wrong with you, what's wrong with him, what is wrong with him, what happened, Because for the most part, children crave and desire love and attention. We all do, right? So it's about asking the right questions, and I think that's one of the things we've been trying to really work with the staff on. I want to talk a little bit about the labeling piece, which I think was really helpful to the child study team staff that attended the training, because we do leap to these kinds of diagnoses when, and it's so much part of the pop culture, right? You hear people say, oh, he's so ADHD, or whatever that means. So, but there is this trajectory that we see sometimes. It starts with ADHD, a little bit older we give them oppositional defiant disorder, a little bit older we give them conduct disorder, and then where are we at? Juvenile justice system. So there is that's that school to prison pipeline that we're talking about. So when thinking about our diagnoses and the things that we're putting in a child's educational record, we want to make sure that we're asking, did we ask all the questions? Because are these behaviors better accounted for by some chronic stressor that with some support for the family, some connection to community resource, we could actually mitigate this impact and we could leave that off the record. So that's something that we go over in the trainings as well. And also I talk a lot about where these children tend to end up. In the next slide, you'll see things like behavioral health settings, substance abuse, because what do people do when they've been traumatized and stressed out? Over time, you learn how to take care of yourself. You medicate yourself with substances and things like that. And this goes back to the ACE study that was discussed on the first panel, which if you haven't read that study, please read it if you're doing this kind of work. They end up in child welfare. As was stated, my hometown has a very high rate of children that are in the child welfare system. And, so this is something that's really near and dear to me when I hear about children getting these diagnoses and then there's no support services around them, or they're getting the wrong service. So it's really important that it starts in the classroom, so our teachers really need to be knowledgeable about this. So this is what I explained to staff. The school is a great place to provide a corrective experience because it's kind of built to be predictable. The day starts and ends the same time, people know the schedule in advance. But in the classroom, there tends to be a lot of variety of what can happen and variability. So for teachers, we are asking them to be really in tune with what's going on with kids and to provide this kind of setting as much as they can every day. And that starts with what they do before the kids come in. And so it's about getting there, having yourself together, making sure that whatever you brought in with you is kind of checked at the door, because when the kids come in, they're all yours. And so that aspect of creating that corrective experience is about being fairly predictable, little things. So when you talk about microaggressions, I think about little things that can set people off. So a child that's been traumatized, sometimes they have a exaggerated startle response. So things tend to scare them more easily. And usually teachers are notified if there's going to be some kind of a drill where there's going to be fire alarms going off all of a sudden. So something small like that. If you know that you have a child in the classroom that has had a lot of trauma in their life, it might be helpful to just maybe be prepared. So you maybe can't reveal because it's supposed to be a secret, but maybe you can know when it's coming. You just stand by that child's desk and kind of be present, just so that you're prepared if there is this kind of reaction. And the other thing I talk to teachers about, another sample slide, and the second point is the one I've harped on the longest, is reframing behavior and not looking at intent as opposed to what's being done. And so I kind of say, what do you think the child's trying to get from you? What do you think the child's trying to control? What are they trying to avoid? Do they act out right before math? Do they tend to act out right before gym, because gym is really unstructured, and that's when kids can be a little meaner because they're not as closely watched. And so this is about really having a better vision, broader, deeper understanding of what can set kids off. And just to kind of close out, I want to talk a little bit about our sort of tier 2, as you were stating. So we created a form, and these are just some of the questions, where if a teacher sees a child's behavior in a classroom kind of becoming a little bit out of control, where they feel like they're not able to manage it, they have a form that they can use to start checking things off. So do you suspect or do you know of something that's happened in this child's life? What have you observed? And we went through, my colleague Alicia's here, over here, and she works on this aspect of the program. But it's wonderful because we've really worked hard to get the language in a way that's not, full of jargon. It's really easy to understand and can be done very quickly. And the teachers, this is what the form looks like. It also has a severity and frequency rating, and asks about your relationship to the students. So even the lady in the hallway that mans the bathroom, or the lunch lady, anybody that sees these behaviors, because sometimes we know the people that know the kids best aren't necessarily the teachers, that they're able to fill this out, and they submit to what is our triage team, and they decide what happens next. And in the event that we think there's a need for a full battery of assessment, after going through the proper channels with families and working with families, there's an assessment battery that we have, and then we try to connect them to care. We have a clinician in both of those schools, which is a wonderful, we know that can't happen in every school, but it is so, the thing about it is we talk a lot about what happens in these systems that are further down the line, but the money isn't getting tossed at the services that might be helpful to prevent them from getting there. So we're fortunate enough to use the dollars that we have to be able to put clinicians in, and this is really through partnerships. So we have these partnerships with other school districts throughout New Jersey, where we have clinicians in various districts in Edison and South Brunswick and other places. So this is a model that I think can be replicated, but it just takes those partnerships with schools and hospitals and universities that have the resources. So some of our outcomes is that we've given 3 of these trainings. Staff have really responded well to them. We really try to make them fun, interesting, and having turnkey skills they can take right back to the classroom. I think one of the biggest pet peeves that people have, even me as a psychologist having to get CEUs, is you go to a training and there's like, that was great, but what can I use this? Can I go right back to where I work and can I use it? So our goals with the training is to be able to give them, this is what you can do tomorrow. You can do it right now with your students. And our professional quality of life scale, as I said, we're still looking at the data, but it appears that there is a high level of compassion satisfaction, which is that I'm satisfied by my work, but I take my work home. Sometimes it bogs me down, sometimes it makes me a little depressed. And so there's a need for self-care to be integrated into either staff and faculty meetings or talking about a self-care plan that everybody has access to. And so we've done some wellness stations at some of our trainings as well to get teachers to take those skills right back in the classroom. And those are things they can do in real time. You can have something at your desk and do some things with the kids. And we've even talked about doing brain breaks, where when you're ready for a break, everybody stops for 5 minutes and let's all do it together, and that's something that is good, not just for the teacher, but for the kids too. It's fun for them. And then just from our screening, we have a small N right now because this is data from January, and as I said, we just started the screening tool in October or November. And so we are finding what shouldn't be surprising. Something like 83% met clinically significant levels of at least one trauma-related symptom cluster, the highest being anxiety, not these aggressive, disorders. This is high on anxiety. So the way a child demonstrates anxiety is very different and sometimes appears to be an acting out behavior, but these are children that are anxious. And so what we do with anxious children should not be the same as what we do for children that are violent and aggressive. And their acting out is really a function of it being anxious. So I think that's really good information to have, and I know it's going to drive some of the things that we're doing going forward. So I like this slide just because I think this is just the facts. We show people what we want to show them, but underneath, what's underneath. And so our role in whatever lane we travel in with children is to dig a little deeper and not just go for what's the easy answer and what's the easy box to check off. And what we diagnose, what we write on papers, what we write on forms, all that stuff matters. And so a lot of what we're trying to do with the work we're doing with BRIC and hopefully with other schools throughout Newark, we recently have developed some new contracts, is to really think about it's more than what we see, and how can we get at that and work together collaboratively across disciplines to really give children and families the services that are not only that they need, but are also going to be helpful. So thank you so much for inviting me.
All of our presenters for their presentations, and now we have an opportunity to open this up for further conversations. Questions? First hand? Okay.
I'm Marcia Atkins, Director of the Healthcare Foundation of New Jersey. First of all, I want to say that I love this panel. I thought you were terrific, and I really thank you for doing this work. I have a question that goes to Dr. Melton and Dr. Moore, because you both touched on this subject, and that's sustainability. So we have put, over the course of our 20-year history, millions of dollars into working to provide mental health services for kids, trauma-informed care, and training for teachers. And as a matter of fact, we did a project at the brick schools that was preliminary to what you're doing now. But the answers that we always get from the local government and the state government is, we think this work is imperative, that it's fantastic, but there's no money for it. So what's the answer to that dilemma? Like, how do we prove, and how do we make governments look at budgets differently so that they can find the money for this very important work?
Well, unfortunately, in New Jersey now, when we change our school funding formula, and I love Dr. Moore's presentation, I'm jotting down the municipalities that she's in, like Brick. They had a very progressive director of special education. He's phenomenal. He's phenomenal. South Brunswick, and she said Edison, and I'm like sitting there saying, wow, the rich get richer. When I start thinking about the 31 Abbott districts in which I worked in, and I still currently go back and forth in, unfortunately, we're in a political climate where people believe the work that we do in public education, we're not doing a good job, or we're getting paid more than our value or the worth. And because of that, unless we have partnerships within our communities with agencies that can provide the training and the sustainability, it's going to continue to be like that. Because right now we know that our school budget makes up almost 40% of the total overall budget. So when you start talking about what it was when it was Abbott school funding and what it's now, and it may change if you can now take a voucher and go to school where you want. Charter schools are designed to do 90% of the effectiveness cost-wise as a public school. So when you start looking at those, every time you open one of those, it hits that school budget. So unless you can wrap it around in your Title I, which none of the schools you're at are Title I schools, where do you get the money? You can only increase your local property tax by 2% unless you go through a special process now. So it's tough.
I don't know. And philanthropy cannot do it all forever. I mean, it just can't.
Hand over here.
Hi. So as we talk about sustainability, the question, or I feel like the big issue around that is being able to show evidence of success, right? And so I feel like, so I have a question, I just want to ground it in that idea, which is that we have schools in New Jersey that are community schools, schools that have dental clinics, social workers in the schools and so on, and they're not moving the needle academically for those kids. And so the challenge there is that if we don't have data that's showing that this approach, like if we don't have a strong pedagogical lens in the classroom, and if we're not able to translate all of this work that we're doing with trauma to showing improved outcomes for kids, then what's going to happen is that we won't get funded, because that's what, because all the philanthropic foundations and all of that, they want to be able to say, we gave $1 million to this, and look how much, look how much better off these children are. And so I guess my question is, is anyone here partnering with educators around how to work how to bring this to the academic frame? Because part of what worries me is when we say, well, gee whiz, how can we expect kids to finish their homework if they've had, a really bad night at home? And for me, when I was in the classroom, I felt like, you know what, with all that craziness that happened last night, doesn't it feel good to know that you can sit down and do this, like doing this homework assignment can be really a gift for a kid, right? Because it provides an opportunity to do something that's rhythmic and, just really helps to ground them. So again, my question is, have you thought about partnering with educators to figure out how to bring this really important work to kids in a way that will move the needle academically for them?
I know one of the things we're doing as far as tracking whether or not this program is working is looking at information from last year on all the measures that they use around academics and even referrals to the vice principal or detention, things like that. We want to look at changes in that over time to see if it is making a difference. Because I think as classroom culture changes and children have space to kind of deal with whatever issue is concerning them and teachers can manage it better, then the lessons move along, things get done, there's not, chaos in the classroom. But I think our partnership at least is trying to look at are there any changes in how kids are actually doing as a result of some of this work? Because we are trying to get families involved as well. But I think it's still early in the process. But that's a wonderful suggestion because I think that it is important to see that these outcomes are good around, are they feeling better, but are they actually performing better? Because that's ultimately they have to do well in school.
There has to be a partnership between that aspect as well as the educational aspect. And I think we need transformative leaders. And that includes transformative principals in schools and who've not been trained on the old model, but are willing to take risks to do things differently. Doctor?
I'm just going to speak to that for a minute. One thing I didn't share about this research is that integrating these approaches into the academic content has made a difference in children's engagement with the academic content.
Right.
So what we see is when packaged curricula come into literacy and they're just using bland, often very biased actually topics. Why would a child engage deeply with those topics? But when you actually build the curriculum from students' lives, they're writing more and more deeply than they ever were before on topics that weren't connected to their lives. So that's one way that we see them now. I will also, though, trouble the outcomes that are used. Because we know that high-stakes assessments are used inappropriately. We know they're biased and prejudiced. And we know that they do not measure rich learning. They're one measure, but they're used for everything. And so we need other outcome measures, right? So we need to expand what counts as an outcome, including interruptions in school and prison pipelines, right? Sustaining through school and connecting to school and having opportunities like those we heard earlier today that are provided at Rutgers and many other places. Those are outcomes that do not get the kind of attention that they need to get.
One of the key factors that you need to consider, and when I leave here briefly, I'm going to the New Jersey Education Association's meeting down the road. And if the partnership with them, meaning that organization for the teachers union, isn't on board, and they're worried about the SGOs and teacher evaluation tool based on standardized tests and everything else, how do you get that buy-in? How do you get that buy-in? And I like to keep things real, and I'm a little direct for a lot of people, but I don't want to waste anyone's time. How do you get that organization to buy in and say this is a concern that we should be addressing, which may increase those test scores? Because if you start to work on the factors that are keeping those young people from focusing and learning, maybe you will make headway, if that is your true goal, to make headway.
Lots of questions. Let me try somebody over this side.
Hi, I'm Vicki Shar. I'm actually a school social worker and child study team at a small district. I have to say my superintendent is a rather progressive man, and his entire, his personal presentation was about trauma in the classroom when we had staff orientation this year. I want to make one point, and then I want to ask a question. My first point is, I think the program you introduced is phenomenal. And I think writing within children in the context of children's lives.
It's fine.
Okay, folks, let's calm down. We're not flooding in here. Continue.
And I think writing across children's lives is also especially important. I try to include that a lot in my counseling. But that being said, there are so many systemic barriers to incorporate this. One, the lack of funding in the state. I'm working in a district right now with a $2 million deficit, and they are cutting child study team members and guidance counselors. Two, I'm all for wraparound services. I don't think you can do this without wraparound services and having connections in the agency, but it takes me 3 to 4 months to get an intake appointment for a family in Bergen County. I can't even imagine what it's like in Essex County, okay? And 3, in this age of trigger warnings now, and I'll give a perfect example of writing around children's lives, I can't tell you what controversy 13 Reasons Why has caused in school systems in the last, and I watched it with my teenage daughter, and I actually thought it had a lot of value if it was approached positively. That being said, so that's the macro level, and if anybody wants to give me, and I'm going to call that director of special services in Brick and say, how did you pull this off? Where did you get the grant? Because that's going to be the key. And the second, my question now is this: on a micro level, as a child study team member, I do social assessments. How do you assess? Because that's one of the challenges we always face. Is this environmental? Is this, or is this academic? How do you tease those out? Because you can have, and I don't like labeling kids unnecessarily, but you can have those environmental factors create learning disabilities. So how do you determine when you're doing an initial assessment what's trauma versus what's an actual learning disability?
I think that it's a good question, because you're right. So as has been discussed, the chronic exposure to stress and what that does to the brain over time, learning and all of that. I think it's that when you have the power to write something, I think that I know from doing psychological assessments myself, if I even think that something smacks of something else, I really make it a point to make sure I include that. I think it's important that it has to be on the record. And so I know that we have to sometimes put people in boxes, we have to sometimes. But I think that in the interpretation and trying to ask the right questions and getting those assessments too, getting assessments that are going to, can we factor in a trauma risk assessment of some kind, that I think that helps us to be able to at least add it onto the record. And that it's not, sometimes you have to understand too, a lot of times the question isn't asked at all. Right. People are not even asking about trauma. Right. They're afraid to ask. There's articles that talk about clinicians being afraid to ask because they're afraid of what's going to happen, that they're not going to know what to do if someone endorses anything. So I think just being able to ask the questions can then help with the interpretation and what gets written in a report.
Right. So
One of the things,
we love questionnaires. We love standardized instruments.
Wait a minute, there are a lot of other people, so we're gonna have to move on. You wanna finish responding?
One of the things, when we do assessments, and this is one thing that by law, under IDEA, you have to do certain assessments.
Correct. That's what I was
Only 2 are required.
Well, yeah, but how do you assess?
Yes.
How you assess? Pencil on paper, teaching a class on assessment, I learned that there are more ways to do assessment than paper and pencil. And if that's the only method you're trying to connect with that person, that young person who's trying, you probably won't get an accurate assessment because kids are not going to do anything if they don't think you care about them as a person.
Correct.
Let's keep it with them.
But the social assessment is coming from the parent, not from the child.
But both.
Both.
It depends on how old they are. Any other questions? Let's go right here.
I had a question about the brick model in Newark and how you are plugging in or harnessing perform care. Like how, if you're linking teachers or if you, I find that I'm in Melton County, like we're trying, and I'm from the kayak there, but we're trying to get, a lot of schools don't know about perform care services and they don't, and the families don't know. So are you linking folks or calling with families for services? What kind of role does it play?
I know that in the event that we refer out, we do have connections to the community resources around the area because traveling is really a challenge and we want to make sure people can get to services. But I think ultimately what we've done is try to do as much as we can in-house and provide those services in-house if we can. I think that's the beauty of being able to have the services in the school. For when it goes out of the school, we're trying to keep it to the local area. And a lot of times those providers are connected through CSAC, through Form Care, that process.
But most school districts are familiar with form care and would have heard
There
parents.
could be, like, that there's home-based
Right.
services, and there's a
Right.
lot of, it's
Yeah.
like, we're talking about money, there's a lot of services those kids are probably eligible for, that if, CMO had their case, they could get services,
Let's call this young man right here.
My name is Joshua Duran. I work at a nonprofit. I work in a mobile response program through the Children's System of Care and do school-based services too. That's a community engagement piece for the mobile response and the CMOs. They go out to districts to do presentations and spread the word like that for sure in our state. But I guess my question for you, Dr. Dutro, was how optimistic are you when you talk to new teachers and prospective teachers about this new career they're going to be in? Because this is not the mold of education. I have 3 sisters. I remember my sister teaching in our basement as a kid, and she's a teacher now. And I became the counselor. She became the teacher. So how optimistic are you when you look at professionals who are being taught really strenuous curriculum and they're moving into this field about this new job that they're going to have, and this really, like Trevor was saying and Kelly, about how perilous it is as a landscape where you're faced with challenges by your administrator. Your whole job may hinge on the test scores that you get. You have kids from all different backgrounds and socioeconomic facing pressures and stress and trauma. How optimistic are you about that next generation of teachers being able to kind of reimagine what their jobs are going to look like?